If you're a nursing student and you struggle with pharmacology, tune in because today we're going to cover a common class of medication that you're going to want to know not only for nursing school, but for your boards. So today we are covering statins. What is a statin? Why do we care? Why do we need to know it? You definitely need to know it, okay? This medication is a lipid lowering agent, and the key thing you want to note here is that it ends in statin. So this is your atorvastatin, rosuvastatin, simvastatin. This isn't an exhaustive list, but you get the point, right? They end in statin. So this medication works to lower cholesterol, but not just any cholesterol, our LDL cholesterol. So L, I like to think lazy. This is our bad cholesterol. So it works to lower that cholesterol, but it also helps to elevate our happy or our HDL, okay? This medication works by inhibiting cholesterol synthesis, and it's used to treat high cholesterol. It's also used as preventative measures for things getting worse for patients with CAD and patients who are at risk for developing coronary artery disease, okay? So brain hack for this medication, when we think of lipid lowering, think LL for lowering LDL, okay? So lots of L's. Just kind of remember that component and piece of information. So precautions and side effects that we need to be aware of. This medication can cause headache, nausea, vomiting. Patients are at risk for toxicity, so we want to be monitoring. Patients can complain of weakness and dizziness. This next one, I want you to star, note, and highlight. Patients can complain of sore or aching muscles. We'll talk about that in just a moment. And it can also cause hyperglycemia. Okay, so nursing interventions, nursing considerations, we always want to make sure we are running our labs, right? We want to make sure that we are checking our LDL and our HDL, and this is prior to treatment, during treatment, because we want to make sure that it's therapeutic. We also want to monitor our ALT and AST. Please note that this medication is contraindicated with pregnant women and those mothers who are breastfeeding. Ignore the spelling error. We also want to encourage patients to report any weakness or sore or aching muscles, because this medication can cause rhabdomyolysis. And so what happens is this medication causes the muscle fibers to be released into the blood because it's breaking down that muscle tissue. So we want to report any kind of muscle weakness, aching muscles, sore muscles to the HCP immediately. And lastly, we want these patients to avoid any grapefruit juice, because it actually can increase the risk of toxicity. If you found this helpful, please make sure you are following this page for more NCLEX content, tips, tricks, and resources. Save this video for later for your own reference and share this with another nurse. Side note, I do have these medication cards available at the link in my bio if you would like an extra resource.